Well, welcome everybody, and thank you for joining us today for this webinar event. And it's not just any webinar event. This happens to be the very first webinar that we have hosted here at our new law firm, Conn Maciel Carey. And I'm Eric Conn, and my partner, Conn Maciel, are just delighted and proud to have this first event kick off and to have you all join us here under the banner of our new law firm. And our new law firm is a boutique law firm focused on employment and OSHA issues, and we're also very excited that this first webinar event can combine those two practice areas and show off a little bit of our expertise in those areas, talking about today Ebola and other infectious diseases in the workplace, focusing in particular on the OSHA and labor and employment implications of Ebola and other infectious diseases, and then talking through some best practices and guidance and recommendations for how to deal with the safety and health side of the Ebola issue, as well as the employment side of the Ebola issue, communications with employees, and the regulatory restraints, limitations, and requirements that are implicated by major health issues like this in the workplace. It's sort of ironic, I guess, that we're doing this webinar today on Halloween, scary topic like Ebola, but I think more so because probably half of you are going home after this and getting dressed up as the Ebola virus as your Halloween costume. So interesting that we're doing it on this day. We had received so many questions from so many employers because their employees are out there anxious about this. It's been covered so much in the news, and there's a lot of information and misinformation out there about this scary disease. So we thought this would be a great topic for us to start our webinar series here at the new firm talking about these issues. Like I said, my name is Eric Conn. I'm a co-founder of Conn Maciel Carey and chair of the firm's OSHA and Workplace Safety Practice Group. My practice focuses on all matters having to do with safety and health, legal and regulatory issues. I represent employers through inspections, investigations, and enforcement actions involving OSHA primarily, state OSHA programs, as well as the Chemical Safety Board, the Mine Safety and Health Administration, the Environmental Protection Agency, as well as other state and local agencies that have jurisdiction over safety and health issues. I work with employers to manage investigations of very serious accidents, and work very often with employers to address enforcement actions issued as a result of inspections, investigations by these agencies, including the full range of litigation and contests of OSHA enforcement actions. I write and speak regularly on safety and health issues, and often work with employers to develop safety and health programs and to audit those programs and to conduct training and compliance counseling as it relates to those programs.
Hi everybody. I am Conn Maciel. I am also a co-founder of the firm, and I chair the Labor and Employment Practice Group here at Conn Maciel Carey, really where I represent employers on really the A to Z of the employment relationship. I'm also a litigator, regularly defend employers in federal and state court under the employment-related statutes, as well as provide employment counseling to employers on the various issues that occur in the workplace with employees. Health-related issues is one of them, anything from hiring, firing, internal investigations. And then finally, I also represent unionized and non-unionized workplaces regarding employers' rights under the National Labor Relations Act. So today, I'm going to kind of kick off the agenda and then spend some time talking really what is Ebola, who is susceptible to this virus. Eric will cover really what the CDC's guidance is and the OSHA implications with respect to the various issues that are impacted by Ebola. And then I will close with the labor and employment implications, anything from ADA, Title VII, and other questions that employers are raising as a result of this outbreak. So let's turn to sort of what is Ebola. Ebola is a fever. It's a disease in both humans and non-human primates that's caused by infection with the Ebola virus. There's no known available vaccine, no known cure, and as probably many of you have read, the fatality rate is high, approximately 75%, and can even rise up to 90% in some of the outbreaks. Okay, so a lot of talk in the news right now has been talking about how the virus progresses and how the states and the federal government is reacting to that process. The first issue is incubation. Those are days 2 through 21. So following really an initial exposure to the virus, it multiplies in the body before the symptoms arrive. And healthcare providers, hospitals, nurses, they have a variety of tools in order to test for the virus infection and diagnose Ebola, which would include blood tests that really are used to detect the antibodies in the virus. Then going from, Eric, I think maybe you might need to move the slides. Okay, so once the symptoms then can have an onset after they become contagious, after the onset of Ebola. And the symptoms that people are looking for, we've talked about and you've seen in the news, include fever, looking at a fever over 101.5 degrees Fahrenheit, fatigue, muscle pain, headache, and sore throat. The issue with that is that, those are really similar to a lot of other viral illnesses. And so people at this time of year get colds and flus anyway, and so those symptoms are very similar, I think, which is one of the reasons why there is such widespread fear and concern, especially upon individuals returning from West Africa. So days 14 through 21 is when the illness then progresses, and that progresses to include nausea and vomiting, diarrhea, impaired organ function, and blood count changes. As the infection progresses, patients can experience rash, internal, external bleeding, which also is how the virus is transmitted. Fever is the most common symptom. 89% of patients experience that symptom, then going through a headache and fatigue, dizziness, diarrhea, pain, abdominal pain, and ultimately vomiting. So after the illness, then it's a question of death or recovery. Ebola patients ultimately die either from the diffusive bleeding and shock. As I mentioned earlier, there's no treatment or antiviral therapy, and there's not an approved vaccine for the Ebola virus. So the care for patients so far have included fluid and blood replacement, maintaining stable blood pressure, and treating other infections. The most effective treatment so far has been the transfusion of blood from a patient with the matching blood type who had previously survived an Ebola infection. So the Ebola virus is really believed to be viable outside of the body for several days and could remain stable for about 4 to 5 days in dry blood, which is why bodies of individuals who die from the virus can remain infectious after death and really needs to be handled accordingly during death care. Individuals who ultimately recover from the Ebola virus are no longer considered contagious. Ebola is really spread through a variety of ways: ingestion of infected blood or bodily fluids, contact with equipment or other objects contaminated with the Ebola virus, and then ultimately contact with blood, urine, sweat, other types of body fluids, either through symptomatic humans or primates in open cuts, scrapes, or mucous membranes. The CDC has broken down exposure to Ebola in 2 categories: high risk and low risk. So the high risk exposure would include percutaneous or mucous membrane exposure to blood or body fluids of an Ebola patient, direct skin contact with or exposure to those body fluids of an Ebola patient without the appropriate personal protective equipment. Processing blood fluids, body fluids of a patient, again, without the appropriate PPE, personal protective equipment, or standard biosafety precautions. And Eric's going to talk about a lot of that. And then direct contact with a deceased body, again, without the appropriate personal protective equipment. There's lower risk exposure would be close contact with patients in healthcare facilities, a hospital or a nursing facility, while not wearing the recommended PPE, and that's what's generated a lot of the media coverage with the hospital in Dallas and the labor union, the nurses union, really is focused on the recommended PPE for healthcare workers. Also being within approximately 3 feet of an Ebola patient or within their room or care area for a prolonged period of time. We're seeing that 3 feet issue arise with the nurse in Maine that is currently quarantined and how she should or should not be around individuals, members of the public. And then direct brief contact, shaking hands with an Ebola patient. The current outbreak in West Africa, I think this is a really interesting slide, is one of the largest and most complex Ebola outbreaks since the virus was first discovered in 1976. There have been more cases and deaths in this outbreak than all the others combined, and it's largely attributed to the fact that this particular outbreak has reached urban areas, whereas past outbreaks have been contained in remote villages. The most severely affected countries in West Africa, as you can see, are Guinea, Sierra Leone, and Liberia. They have weak health systems, not strong infrastructural resources, and really only recently emerged from a long period of conflict and instability. And so it's really been declared a public health emergency of international concern by the WHO. In comparison to the United States, we only have a handful of issues. So it really demonstrates that paranoia probably is not quite the level it needs to be here in the United States, with only one example of an individual who has died from the disease. But it's still an issue that needs to be of concern and is of concern to employers. And so that's why it's important that we're covering the issues that we're going to cover today, because it's in the discussions of the Ebola-related precautions, it also is relevant to any other type of outbreak of other infectious diseases. So the United States has developed a travel policy in response to the Ebola issue in West Africa, and that policy has really rapidly evolved as the issue has developed over the last few weeks. On October 21st, the Department of Homeland Security announced travel protocols that are applicable to everyone entering the United States from the 3 West African nations that we just talked about, and have highlighted that they're all rerouted to one of 5 U.S. airports in New York and New Jersey, Georgia, Illinois, and Washington, D.C. In the event that one of these travelers begins to show symptoms of Ebola, public health officials will then implement an isolation and an evacuation plan to limit the exposure and direct the individual to a local hospital that has been trained to receive potential Ebola patients. You'll see that each of those travelers receive enhanced screening from the CDC, the Customs Border Protection. They're given a care kit in order to monitor their symptoms, and then are required to report in with public health officials on a daily basis. Some states have enacted more restrictive travel policies. New York Governor Andrew Cuomo, New Jersey Governor Chris Christie, and Illinois Governor Pat Quinn have instituted heightened travel restrictions in their specific states. This has generated a lot of criticism and also really a national debate between federal health officials and the White House, talking about what the right thing is to do with respect to individuals that are returning. In New York specifically, people returning from an Ebola zone but who have not had contact with patients will be handled on a case-by-case basis. Returning healthcare workers who show symptoms will be transported to a hospital for a mandatory quarantine. And then the temperatures of asymptomatic healthcare workers will be checked 2 times a day. New York, Governor Cuomo appears to be softening his stance, whereas Chris Christie is not in New Jersey. He is really standing firm on his policy, which means that any returning resident who has had contact with an Ebola patient is subject to mandatory quarantine, regardless of where they're symptomatic, for 21 days. And we have seen that in the case of the nurse who returned and then was transported up to her home in Maine, where she is under quarantine, and there's that's generating a huge national debate. She went out for a bike ride yesterday to show that she is not sick. Her boyfriend was with her, and he is commenting that these quarantine policies will impact spouses and families. It's not just about the individual as well. And ultimately the governor needs to decide at that point in Maine whether he needs to issue an order that's going to require her to stay in her home. And so it's continuing to create really a national dialogue on the scope of these types of travel policies. In Illinois, returning high-risk individuals who've had direct contact with an Ebola patient will undergo also a mandatory 20-day home quarantine. So there's, obviously some industries and workers who are more susceptible than other workers. Obviously, workers who are performing tasks involving close contact with symptomatic individuals with Ebola, or in environments that are contaminated or reasonably anticipated to be contaminated, are really at the greatest risk of exposure. So we're looking at healthcare workers, laboratory workers, first responders, humanitarian workers, funeral and mortuary workers, waste disposal workers, and airline and other transportation workers. But that doesn't mean that employers from all industries should not be mindful of the types of plan and preventative measures that we're going to be talking about, and in particular, how to communicate with the rest of the employee body and answer questions to the extent that employees have questions about other coworkers who may have had contact, or family members, or schools, children who have been in contact. So it really does apply to a variety of different industries and types of workers, despite the fact that these are the industries and workers who are probably most susceptible of actually becoming symptomatic with Ebola. And with that, I'm going to turn it over to Eric to talk about the CDC guidance for Ebola prevention.
Thanks, Kara. And I'm going to talk about this in sort of two steps. First is what the Center for Disease Control has to say about protecting employees who have potential exposure to Ebola and other infectious diseases, and then sort of walk that into the OSHA implications of this. And a lot of it is similar. CDC is out there saying these are good practices, these are best practices, these are things you should consider in your workplace. And a lot of those map directly to OSHA regulatory requirements. So it'll be an interesting sort of comparison of these recommendations from the CDC and what we may see from an enforcement standpoint by OSHA. So thinking about the CDC's recommendations, and these recommendations tend to focus on protecting employees who are really in an Ebola zone. These are either humanitarian workers, healthcare workers who are in West Africa working with patients there, or now as the disease has come to our shores through returning healthcare workers or travelers who have brought the disease with them to the U.S., for those employees who may be working around, or those individuals who may be working around or spending time around Ebola patients. And that would be, as Kara said, most often in the healthcare setting, but there are other settings. There's a question that popped up already about hospitality workers. Absolutely. Folks who handle contaminated materials like laundry. You see that in the healthcare setting, in the hospitality setting, in the airline setting. There are potential exposures, and these guidance recommendations from the CDC and from OSHA that we'll talk about in a little bit apply across the board. So, the first, and one thing that's interesting here is we're talking about Ebola, and Kara mentioned this, but I mean, it's good that the Ebola scare has us talking about this, but in my opinion, it's not Ebola that we really need to be so panicked about, but there certainly is something to worry about in the context of pandemic and infectious diseases. And there are infectious diseases out there like the flu that cause a great deal more fatalities in the United States than Ebola, but the precautions and the good judgment and the administrative controls and the engineering controls we're going to talk about today apply regardless of the infectious disease that we're talking about. So it's good that we're talking about it, good that we're thinking about it, and good that we're educating ourselves about some of these precautions. For example, washing your hands frequently, and this is good advice We tell our kids this all the time. This is a way to minimize the transmission of infectious diseases. Wash your hands frequently and use hand sanitizers, particularly important when you're in an Ebola outbreak area. Avoid contact with blood and bodily fluids of infected patients. Avoid contact with dead bodies. As Kara mentioned, the disease can linger, the contagion can linger for some time after an individual passes on, and so you've got to be careful in how we handle Ebola patients, how we handle surfaces and materials that have been used to treat that patient or that patient has come into contact with. Obviously, seek medical care immediately if you develop any of the symptoms of Ebola. And this is one of these problematic areas where the symptoms of Ebola are not so different than the symptoms of some of our more common illnesses. So it's important when we're dealing with a situation like this that we're on a bit higher alert and that we're seeking medical care, medical attention when you start to develop these symptoms. And then, we talked about the travel restrictions for coming into the country. The CDC has recommendations about avoiding non-essential travel to parts of West Africa or other parts of the world where we know that Ebola outbreaks are happening. And CDC has a terrific website where this guidance about travelers, guidance about the travel recommendations and limitations are laid out, and I'd encourage you to take a look at that. The CDC has very specific guidelines on personal protective equipment, and this has gotten probably the most attention of anything here in the United States because of the transmission of the disease to a nurse in Dallas, which has been attributed to, as I understand it, either improper donning and doffing of the PPE equipment or not proper PPE equipment to begin with. So there's been a lot of attention on this issue by OSHA, by the CDC, by NIOSH, by others. And the CDC just put out, like 10 days ago, put out updated guidance for what PPE should be used and how it should be used. And they actually, this image on the slide is a still from a video that they have that walks healthcare workers or anybody who is in a place where they need to don and doff PPE to work around Ebola patients or to work around materials or surfaces that may be contaminated by Ebola. A step-by-step video that shows you what you should use, how to put it on, how to take it off, how to dispose of it. And one of the recommendations, and this is an important one, that they have recommended that workers receive repeated training. And I thought that was noteworthy because this is something you might say, okay, here's the PPE we're going to use, we're going to do a training session, and we're going to move on. They're recommending repeated training, repeated reminders. You can become complacent after you've done this a few times, so this is something that the CDC is recommending you do repeatedly, and that's something to think about as to how OSHA might address this. What is their expectation about training, and has that expectation changed because of industry consensus recommendations like this from the CDC? Repeated training as well as a demonstration by the employee who will be wearing the PPE, demonstrating their competency in those procedures for putting on and removing the PPE. And that's before you're going to work around potentially infected persons or materials, demonstrate that you know how to use the gear. All workers must be supervised by a trained monitor as they don and doff and dispose PPE, and that's what you're seeing in this still photograph here. The nurse on the left is the one who's actually going to go into the isolation room and work around an Ebola patient. The gentleman on the right is the monitor, and he is a person who is required to look at the PPE as it's being put on, help inspect it to make sure it's not damaged before it's put on, make sure that the nurse who can't see front, back, top, and bottom of herself, he can see, is there exposed skin? Has it been applied correctly? Has it been put on correctly? So there's a monitor now as part of this process as well. They recommend inspecting the PPE prior to putting it on, see if there's any tears, rips, or damage. When it is worn, the PPE should result in no skin exposure at all. The PPE must remain in place throughout time working in and around contaminated areas. It should not be adjusted. when in the space where you're working around contaminated materials or infected persons. You should, even while wearing the PPE, frequently disinfect your gloved hands, especially when handling bodily fluids. And the last step here, and I think this is really being driven by what happened in Dallas, is that since the removal of PPE is a high-risk activity, perhaps the highest risk activity in this process, you should always develop and use a step-by-step procedure, use a trained observer, this monitor that we're talking about, and do the activity in a designated removal area. In addition to these sort of engineering controls, the equipment, the physical barriers that we use to separate employees from the virus, the CDC has also recommended administrative and environmental controls. For example, establishing and implementing a triage protocol to effectively identify those patients who may be infected with the disease and then immediately putting them into an isolation area, testing to see if they are in fact affected, and beginning the treatment process. Designate site managers. This would be at a healthcare facility or other facilities where you might reasonably anticipate infected persons might be present. Designate a site manager to ensure the proper implementation of all of your exposure control procedures, including the PPE procedures, needle stick prevention procedures, and the isolation procedures we're talking about. Someone who's in charge, who's always there, who will supervise this infection control process. Training. Training is mentioned. You can't go 3 lines through the CDC's guidance. You can't go 3 lines through OSHA's guidance, through OSHA's website, without some reference to training. Training, the most important thing. Make sure employees understand your infection control procedures. Make sure they understand your bloodborne pathogens program, and make sure they understand what PPE should be worn and when, how to put it on and take it off, how to care for it, how to maintain it, how to dispose of it, how to handle disposed potentially infectious materials. Training is absolutely critical in ensuring a safe workplace. Isolating Ebola patients, and the recommendation from the CDC is that you not have a wing where all of your Ebola patients will be located, but that they're each in an individual isolated space. And then limit the personnel who have a need to go into that area. And then conduct effective environmental cleaning of that space, of the materials that are used to work with those patients, and laundry, contaminated surfaces. Make sure you have an effective environmental cleaning program. That was sort of the main focus by the CDC on healthcare workers. They have also broken down in that sort of methodical step-by-step, here are procedures, here are policies, here are good recommendations that you ought to implement as it relates to healthcare workers. They've done the same thing for a lot of these other industries and work practices that Kara talked about as being highly susceptible work areas. And I would encourage you to visit the CDC website, or if you have questions, we can try to address them about some of those engineering controls or administrative controls that can effectively protect laboratory workers, funeral mortuary workers, humanitarian aid workers, airline workers, first responders, and folks who are in a position or often reasonably expected to be exposed to these types of infectious diseases. So let's talk about that. That's the guidance from the CDC. Now let's talk about OSHA as an enforcement agency. What are some of the regulatory implications of Ebola or outbreaks of other infectious diseases here in the U.S.? And the focus here is on the existing standards and requirements that OSHA already has, and in the bottom right corner of this slide, you'll see that OSHA has initiated, sort of coincidentally, before the outbreak of Ebola in West Africa, and it's sort of making its way to our shores, an infectious disease standard. They've initiated that rulemaking process. If any of you have watched the OSHA rulemaking process, know that this is not a speedy process, so I would not expect that we will have an infectious disease standard in place while this current Ebola outbreak has been resolved. But they've started the process, they're thinking about it, and my guess is that the rulemaking process is likely to be informed by what we're seeing in this outbreak. It's going to be informed by the issues that we saw in Dallas and in other parts of the country. So it's worth paying attention to. So we're going to talk a little bit about the infectious disease rulemaking that's underway, but in the interim, until there is that rule, OSHA has a profile of other standards and regulations that are implicated by a disease like Ebola and other infectious diseases, and we'll walk through those standards and how they're implicated and what you should be doing in your workplaces to make sure you're complying with the standard and making sure that those efforts are effective as well in addressing safety and exposure to these types of diseases. The first and most obvious is the Bloodborne Pathogen Standard. This has existed for a long time, and it is sort of tailor-made for the type of virus that Ebola is. It is primarily transmitted by blood and other infectious materials. It is not primarily transmitted by aerosol, by air. So Bloodborne Pathogen Standard is sort of tailor-made for this type of disease. Because Ebola is transmitted by blood and other infectious materials, Ebola is very clearly covered by the standard, and the standard requires employers, not just healthcare workers, but any employer where there are reasonably foreseeable occupational exposures. You have to have a bloodborne pathogens program, you have to develop an exposure control plan, and you have to implement that plan. So whether this is in a hospital, on an airline, in the context of the hospitality setting where you're handling laundry materials, bed sheets, perhaps needles and other materials left behind by guests, and other workplaces where you might anticipate or an employee's job it is to encounter and deal with, maybe your janitorial staff, dealing with blood or other infectious materials. You have to have a bloodborne pathogens program. You have to have a written exposure control plan. You have to review and update that plan annually. You have to evaluate whether there's newer technologies, and my guess is we might see newer technologies coming out in the wake of this Ebola outbreak. You've got to consider whether that technology is appropriate for your workplace, and then you've got to provide training. This is OSHA kicking in now saying you must train on your exposure control plan. You must train on the tools that you are implementing to eliminate exposures in the workplace. And then, of course, if you have an exposure incident, an employee is pricked by a needle that has been used on a patient, the employee who handles your laundry, the employee who handles disposal of your used medical materials, if they encounter or stuck by, scratched by some of those materials, you've got to track those incidents, and you've got to provide post-exposure evaluation and follow-up for those employees, offering certain vaccinations, certain treatments, certain blood tests, and certain education to them about what they may have been exposed to and what type of treatment they ought to seek out. And that's been around for a long time. This is not new because of Ebola, but it is certainly applicable in the wake of this Ebola outbreak. OSHA's Bloodborne Pathogen Standard also talks about universal precautions, and this is the concept of treating all bodily fluids as infectious. So rather than saying, well, we know this patient is healthy, so this blood and other bodily fluids we're not going to handle using our special precautions, but this over here, this is an HIV patient, this is an Ebola patient, this is a hepatitis patient, we're going to treat that blood or infectious material differently. OSHA encourages and in many instances requires universal precautions. Treat all bodily fluids as though they are infectious, and therefore implement your infection control procedures as it relates to all of these materials. And because of that, we're going to take steps to minimize needle stick incidents. We're going to take steps to minimize splashing and spraying of blood. We're going to ensure appropriate packaging and decontamination of waste products and waste materials and surfaces in areas where that material may have been. We're going to provide and require the use of appropriate PPE. Remember the focus by the CDC on proper use of PPE. That comes up in your bloodborne pathogens program, and it comes up in OSHA's PPE standard that we'll talk about next. And then implement proper procedures for the disposal of regulated waste and the handling of contaminated laundry. And again, this applies across all of those industries where you might encounter contaminated laundry or waste materials. OSHA has a PPE standard, and this has been, the single most important piece of engineering controls that has been talked about here in the U.S. because of what happened in Dallas. And OSHA has a long-standing standard that addresses exactly what happened in Dallas and addresses what you all should be doing in your workplaces if you encounter potentially infectious diseases or any other hazardous substances that can be addressed by the use of proper personal protective equipment. The PPE standard requires as step one that employers evaluate their workplace, regardless of whether you're a healthcare facility, a construction site, a petroleum refinery, you name it. You have an obligation to evaluate your workplace, identify the hazards that are present, and identify what PPE may be necessary to address those hazards. And then, if you have identified hazards that can be or should be addressed by PPE, employers have a duty to select, maintain, require the use of, store, and clean that personal protective equipment. And then, once again, training. Training comes up here as a mandatory element of OSHA's PPE standard. You must train your employees who are required to use PPE in your workplace, when the PPE is required to be used, specifically what type of PPE they should be using, how to properly don and doff the PPE, how to properly adjust it, how to maintain it, how to clean it, how to store it, how to care for it, and how to dispose of it. These are important elements of a training program that OSHA mandates as part of its PPE standard. And then very importantly, you are required to train employees in the limitations of the PPE. And this comes up, I think, particularly in the context of infectious diseases, where employees may think a certain type of glove or a certain type of dust mask may be sufficient to address the hazard. Well, if there are limitations of that PPE, it doesn't work for aerosolized, potentially infectious materials, or it's not appropriate for the type of workplace that you're working in. You've got to communicate the limitations of that PPE to make sure they understand that this doesn't protect you from all hazards. And then finally, understanding the useful life of the PPE. If you've got a respirator or a piece of equipment that wears down eventually and is less effective over time, you have to evaluate that. What is the useful life? And make sure that employees understand that and that they're not using an ineffective piece of PPE after its useful life has expired. Respiratory Protection Standard, another long-standing OSHA regulation that is implicated by infectious diseases. Like the PPE standard, OSHA's Respiratory Protection Standard requires employers to identify certain types of hazards. In the instance of respiratory protection, it's those airborne hazards. And if there are airborne hazards present in your workplace or reasonably foreseeable, you have to implement an effective respiratory protection program. And in this instance, talking about Ebola and infectious diseases, where there are workers who may be exposed to bioaerosols containing Ebola, and again, this is not a disease that typically transmits through aerosol, but if you're engaging in work practices that aerosolize blood or other bodily fluids, like water cleaning or things like that, then there may be airborne exposures that may be present, in which case you have to identify what type of respirators are effective for working in that area, and then develop procedures for the use, donning and doffing, storage, cleaning, and maintenance of those respirators. Then again, very importantly, the training element kicks in. Train your employees how to use it, when to use it, and what specifically they should be using in terms of respiratory protection. And in terms of respiratory protection, there's two different types of, or really one specific type of training that is required, and that's called fit testing, making sure that the employee puts it on properly and creates an effective seal so that air and airborne contaminants do not get inside the respiratory protection. And then there's also an element of the respiratory protection program called medical evaluations. You need to make sure that your employee is medically able to wear a respirator. There are some employees, either because of asthmatic conditions or other conditions, who may develop other health implications just by wearing a respirator. So you need to evaluate their ability or have someone evaluate their ability to safely wear a respirator before you put them in a position where they are required to wear a respirator. And your respiratory protection program ought to be overseen by knowledgeable, competent persons. In the context here, talking about Ebola and infectious diseases, OSHA and NIOSH recommend certain types of respirators. In particular, it's a particulate filtering face piece respirator, which is essentially a dust mask with a filtering face piece. NIOSH recommends a proper filter material, which is N95 or greater. That's the sort of the effectiveness, the concentration of the filtration component of the dust mask. And these masks of that level will prevent the inhalation of small particles, including airborne transmissible infectious agents. The recommendation here, you're required to use or identify effective respiratory protection. That should be NIOSH certified, and it should be at least able to be tightly, to fit tightly and prevent air leaks. Now that's sort of the PPE, the respiratory protection that's required to protect you from the Ebola virus and other airborne infectious viruses. But there's another component here. The working around this disease, whether it's in the workplace or whether it's in the healthcare setting or hospitality setting or airlines or whatever, there is a major component now of using fairly robust chemicals to clean and disinfect surfaces and to clean and disinfect the materials that are used to work with infected persons. Now, those chemicals have their own potential respiratory and other hazardous elements. And so you need to evaluate, is there a different type of respiratory protection required for working with these rather robust hazardous cleaning or disinfecting chemicals? And often that might be an elastomeric respirator with cartridges, a bit more of a robust process. Supplied air, breathing air type of respirators may be necessary for the chemicals you're introducing to deal with this hazardous agent. And I think for most of the folks on the call here, if you're not in the healthcare setting and you're not dealing with actually working with patients, this slide right here is perhaps the most important one in all of the OSHA slides we're talking about today. There's a public panic out there about this disease. There's a lot of misinformation about this disease. And my guess is there's a lot of your employees out there, I know there are because we've been getting a lot of questions about this, the employees who come in and say, I want to wear a respirator, I want to wear a mask here at work because I'm scared about this thing. And if I'm going out into public and, we work a mile away from a hospital or we work out in the yard of a hospital that's treating an Ebola patient, or I know that my employees or coworkers are traveling and I'm just worried about this, I want to wear respiratory protection. The employer is not requiring it. There's no OSHA standard that requires it. It's not necessary to protect the health of that employee. In those circumstances, it's what's called as voluntary use respirators. And a lot of employers think, well, sure, if the employee wants to wear it, go right ahead and wear it. I've got no responsibilities here. That's not true. If you are going to allow employees to use respirators on a voluntary basis, you are still required to implement components of a respiratory protection program. If the respirator that employees are using on a voluntary basis is the type of dust mask we've been talking about, a filtering face piece mask, it's a fairly simple requirement, and that requirement is to provide the information that is contained in Appendix D of OSHA's Respiratory Protection Standard. So if employees are bringing in their own masks or you're making masks available to them, you should either post or hand out or talk about in a safety meeting the elements of Appendix D of OSHA's Respiratory Protection Standard. And generally, Appendix D talks about limitations of respiratory protection, how to properly use it, what some of the hazards that employees might encounter by using a respirator itself. You've got to communicate that to employees if you're going to allow voluntary use of a respirator. And if you're allowing voluntary use of a more robust type of respirator, supplied air, cartridges, full face type of respiratory protection, not only do you have to supply Appendix D to those employees, you actually have to implement quite a few of the elements of the written respiratory protection program, including evaluating the employees to make sure that they can safely, from a medical standpoint, wear a respirator, and then make sure that the employees understand how to properly clean it, store it, and maintain it in the same way you would if you were mandating the use of the respirators. So an important issue here that we're seeing in a lot of workplaces right now as the public panic arises about Ebola and perhaps when flu season kicks in. Another standard that's implicated here is the Hazard Communication Standard. And there's been a lot of talk about the HAZCOM standard lately because of major changes to it as it relates to the global harmonization following GHS requirements. OSHA has updated the HAZCOM standard. The HAZCOM standard does not apply to infectious diseases, but just like we talked about in the context of respirators and personal protective equipment, the fact that you are working around the Ebola virus or other infectious diseases certainly means we are implementing or introducing some pretty robust chemicals into the workplace. Decontamination chemicals, cleaning chemicals, things like that. And where you are introducing robust hazardous chemicals like that, the Hazard Communication Standard applies. It is the primary standard in OSHA's arsenal that applies to handling the hazards of chemicals like that. And in this instance, if you've got those chemicals, you have to develop a written hazard communication program, maintain a list of the hazardous chemicals that are present on site. Importantly, maintain a safety data sheet accessible to employees that identify the hazards of that chemical and how to treat that chemical and what to do if you are exposed to that chemical, what PPE you should wear if you're working with that chemical. Have that SDS available to all employees who may encounter that chemical at the workplace. Ensure that containers of hazardous chemicals are labeled. And here's where we see a lot of folks get in trouble, where you've got a bulk package of a hazardous chemical that's labeled, and you transfer from that bulk package down to individual containers that might be used for cleaning, a spray bottle or a smaller container to move throughout the workplace with. Those containers also need to be labeled if they contain the same hazardous chemical. Training. Training is a huge component of the Hazard Communication Standard. Train employees in the categories of chemicals that are present in the workplace, the hazards of those chemicals, how to address exposures, and then importantly, where to find and how to read the safety data sheets that provide that information in detail on a chemical-specific basis. You need to make sure that warning labels are affixed to all containers of regulated waste and packages that contain hazardous substances. One thing that's always worth talking about, no matter what hazard you're dealing with, is OSHA's General Duty Clause. This is the catch-all provision in OSHA's statute that says if we don't have a standard that addresses exactly what is going on here, we can still issue you a citation because you have a duty as the employer to provide a workplace free from recognized serious hazards. And certainly Ebola and well-known infectious diseases are recognized serious hazards. They may not be recognized serious hazards in your workplace or in your industry, but that's something to pay attention to. And here is where we look to things like the CDC Guidance, where it may go further than an OSHA standard. OSHA will often point to some consensus guidance document and enforce that as though it's the law through the General Duty Clause. So it's important to pay attention to things like NIOSH notices, CDC notices, World Health Organization notices and guidance, because OSHA may point to that and say, even though it's not required by our PPE standard or our bloodborne pathogen standard, it was well recognized, it was well understood to be an effective way to address a hazard. Everybody knew about it, you should have known about it, therefore it's a violation of the General Duty Clause. So look out for that.
Eric, as you're mentioning some of this stuff too, will you also focus and talk about how this would impact the retail industry?
Sure, yeah, and I think that's where we think about a lot of the standards we've talked about that wouldn't typically apply in the retail industry, it's not reasonably foreseeable that you would have exposures to hazardous chemicals or hazardous agents like the Ebola virus. So maybe those standards don't traditionally apply to you, but something happens in your workplace. I mean, it's going to be fairly unique where one of your workers, one of your employees has returned from West Africa, is demonstrating symptoms, and do you respond and do you react consistent with the CDC guidance? Are you decontaminating workstations and surfaces consistent with CDC guidance or some of OSHA standards? And if not, you could be held to account under OSHA specific standards or under OSHA's general duty clause. I mean, that's the idea here. As these guidance documents are put out, either by OSHA, NIOSH, or some other organization, OSHA will use those and enforce those under the general duty clause. So really, whatever industry you're in, if you have a condition that pops up, you have an Ebola infected employee, are you handling it the right way? Are you handling exposures to work surfaces that he may have encountered consistent with the Bloodborne Pathogen Standard? It's a matter of it wasn't something that was recognized until it became recognized, and once it became recognized, all of these requirements kick in, and you're going to be perhaps held to account for them in the enforcement context. And one thing here, I think Kara is going to talk about this in more specifics in her presentation on the employment side, but OSHA has an anti-retaliation provision in its statute, and I think this is an issue that employers across all industries may encounter, where a coworker of a sick employee, not necessarily an Ebola sick employee, but an employee who has a fever and who has demonstrated symptoms of Ebola, the coworker sort of freaks out and says, I don't want to be around this, I'm not coming into work. There may be restrictions on employers and how they handle that, because if the employee has a good faith belief that there's an imminent danger and there's not time for that danger to be addressed through regular statutory enforcement, i.e. complaint to OSHA, OSHA does an inspection, OSHA requires abatement, that employee can take action. That employee can stop going to work. He can, stop doing a work activity and make complaints and do all sorts of other things. And there are serious restrictions on what employers can do in response to that if the belief by the employee is reasonable. And I know Kara is going to talk about that in some more detail in her discussion. So last thing I wanted to sort of cover here, a couple things at the end are some specific guidance points that OSHA has put out, and that I think OSHA will, whenever they put out guidance, look out for it, because it is often a wolf in sheep's clothing. It's more than guidance. You will be held to account to it, either under the general duty clause or under their specific standards. And here, follow OSHA's and other agencies and organizations recognized and generally accepted good infection control practices. For example, the CDC's latest guidance, I really see OSHA enforcing that guidance as though it's the law through either its standards or through its general duty clause. Make sure you're complying with applicable OSHA standards that we talked about. Use PPE effectively. Use effective hygiene, hand hygiene practices. Train your employees in those and make sure that that's being used for your employees directly and for surfaces and objects that may be contaminated. Train your workers effectively in what to look out for. What are the symptoms that they should be looking out for? What are conditions in the workplace that they should be looking out for that may demonstrate potential exposures or demonstrate potential infections? Train workers in the sources of exposure and the appropriate precautions that they should be taking. States have stepped up here where they can move much quicker than federal OSHA, and Cal OSHA, for example, has put out some direct interim guidance, and they actually have some aerosolized infection standards already, like the infectious diseases rulemaking OSHA has undertaken. So Cal OSHA is sort of out front on some of these issues, and they have similar guidance that they've put out, making sure we're using PPE effectively and making sure no skin is exposed when we're working around exposed persons or objects. training on PPE procedures, opportunities to practice with PPE before being in a position where you're around infected persons or objects, making sure we have dedicated areas for donning and doffing PPE, using the buddy system, remembering this recommendation from CDC about using a monitor. That's not mandatory in OSHA's PPE or bloodborne pathogen standard, but I'm willing to bet it's going to be enforced as though it's mandatory. It certainly will be in California. I think federal OSHA will as well in the context of the general duty clause.
Eric, a question has come in. Although if it's not mentioned on name on a disinfection label, would you recommend using a disinfectant effective against non-enveloped viruses?
You know, I'd have to look at the product in particular, and this is something where there's going to be good guidance out there by CDC and by NIOSH that identifies effective disinfectants for various agents like Ebola and other infectious diseases. That is sort of similar in concept to respiratory protection. That there is different respiratory protection appropriate for different agents, different exposures, and I would want to look at the specific material you're talking about, and I would really just recommend cross-checking that against recommendations from CDC, NIOSH, and others who have looked at this in more detail. But that's a great question. You know, not all disinfectants are alike. Not all cleaning agents are alike. Not all respiratory protection is alike. And there are certain, you know, equipment and chemicals that are right for certain chemicals, certain biological agents, and you want to make sure you're using the right one for the right circumstance. So that's something it's definitely worth paying attention to. Wanted to talk real quickly about OSHA's infectious disease rulemaking before I turn this back over to Kara. And this is, like I said, probably a long way off into the future, but this is OSHA's effort to sort of expand on what the bloodborne pathogen standard has done for bloodborne and bodily fluid exposures to disease and biological agents. This will address those airborne and aerosolized agents that are not covered by the bloodborne pathogen standard. That we haven't seen a proposed language for the rule. I don't think. They have just tell you where we are in the process. OSHA put out a request for information, collected a lot of information and comments from industry and stakeholders back in 2010. Earlier this summer, they put out a pre-rule published in the spring agenda and have just announced convening a SBREFA panel, getting together small business interests to talk about how this proposed rule might impact small employers. And the deadline for the SBREFA submission is coming up at the end of this year. So if you want to participate in that process, I think I saw a note. I didn't read it carefully yet, but I know Bruce Lundegren is on this webinar and has put a note in about that. He runs that SBA process, and that's a great opportunity to have your voice heard in the rulemaking process. So, you know, contact me or contact Bruce if you want to be involved in that process. But we're looking out for a rule there that I think is likely to be somewhat similar to OSHA's rule that addresses aerosolized infectious agents, and in a lot of ways will be like the bloodborne pathogen standard, but just not addressing those blood or bodily fluid contaminants. Covered a lot of material here, talked pretty fast, I'm sure. If there are other questions, I'm going to look through the chat here in a moment, but if you couldn't tell, I'm a huge OSHA nerd. I love talking about this stuff. If you ever have questions, even after today, don't hesitate to call, shoot me an email. Would love to just chat with you about questions you've got, ideas you have, experiences you've had in these areas. And with that, I'm going to turn it over to Kara to talk about the labor and employment implications of Ebola and other infectious diseases.
Okay, thanks, Eric. Yeah, in the last 25 minutes or so, I'm going to talk about what those labor and employment issues are. We're getting a lot of questions from employers across all industries. It's not just from hospitals and healthcare workers, but, you know, grocery stores, retailers, hospitality, restaurant owners, you know, hotels, asking sort of what questions can they be asking of their employees? How can they be communicating with employees who have questions about coworkers or family members or children? And what are the employment-related issues and legal issues that you need to be mindful of? And some of the laws that come into play are the Americans with Disabilities Act, Title VII against discrimination, the Family and Medical Leave Act that allows protected leave for individuals with serious health conditions. There are a number of state leave laws, including some paid leave laws that could come into play, HIPAA, and then finally I want to touch on the labor union aspect of this, even if you're a non-union employer, because the nurses union and other labor unions will be using this as a rallying cry. So let's talk with the Americans with Disabilities Act. Hopefully most of you all know that the ADA not only protects employees but also applicants from disability discrimination. And so what it does is it regulates an employer's ability to ask disability-related questions and to conduct medical examinations. It also prohibits employers from excluding individuals with disabilities from the workplace for health or safety reasons unless the individual poses a direct threat, and I'll talk a little bit about that. And then finally, it requires an employer to provide a reasonable accommodation for an individual with a disability absent any undue hardship that you may be facing. So, as I said, it talks about disability-related inquiries. So an inquiry is considered disability-related if it's likely to elicit information about a disability. So, for example, if you ask an individual if his immune system is compromised by a disability, would be considered a disability-related inquiry because a weak or compromised immune system is closely associated with certain conditions, certain medical conditions. But on the other hand, an inquiry would not be considered disability-related if you're asking about symptoms of a cold or symptoms of the seasonal flu, because you're not eliciting information about a particular disability. A medical exam under the ADA is a procedure or a test that's looking to get information about someone's either physical or mental impairments or their overall health. So whether a procedure is considered a medical exam under the ADA is determined by a number of factors, such as whether you're going to be using medical equipment, whether the test is invasive, whether it's designed to reveal the existence of a medical condition or a physical impairment, and whether it's being done or interpreted by a medical professional. If those factors are in play, then it likely is considered a medical exam, and the ADA is going to come into play as to when you can either provide a disability-related inquiry or require a medical exam. For applicants, for individuals that are just applying for your workplace, you cannot ask disability-related inquiries and you cannot require a medical exam. It's not until you give someone a conditional offer of employment that you can start to make those inquiries and exams, but it has to be done for all new hires in that job category. And the inquiry and the exam has to be identical so that you're treating all similarly situated employees the same. And then once someone becomes employed, generally the inquiries and exams are prohibited unless they are job-related and consistent with business necessity. And it's going to be considered job-related and consistent with business necessity if you have a reasonable belief based on objective evidence that an employee's ability to perform his or her essential functions of the job will be impaired by the medical condition, or the employee poses a direct threat due to a particular medical condition. A direct threat is a significant risk of substantial harm to the health or safety of the individual or others that cannot be eliminated or reduced by a reasonable accommodation. If an individual with a disability poses a direct threat despite a reasonable accommodation, that individual is not protected by the Americans with Disabilities Act, and you can require them not to come into the workplace. So generally, the ADA, you look at 4 factors to consider in determining whether someone poses a direct threat. You want to look at the duration of the risk. That gets into the incubation period that we talked about earlier in the beginning of the slides. That comes into play. The nature, the severity of the potential harm, the likelihood that potential harm would occur, and then the imminence of that potential harm. The assessment, when you're conducting an assessment of whether an employee poses a direct threat, really needs to be based on objective evidence and not on any subjective perceptions or any type of irrational fears about a particular disability or medical condition. So So interestingly, in 2009, the EEOC, the Equal Employment Opportunity Commission, released technical guidance in response to the H1N1 pandemic about how to plan for pandemics in the workplace. While the EEOC has not yet released similar guidance as it relates to the Ebola outbreak, this guidance in particular is very useful, and I would recommend every employer read it and get a copy of this from the EEOC website. It covers a lot of questions that we're getting. For example, how much information can employers request from employees who call in sick to protect the rest of the workplace? When can an employer take an employee's temperature during a pandemic? And does the ADA allow an employer to require an employee to stay home if they have symptoms? So we'll go through some of that. Before a pandemic, what are some employment considerations you should implement in your workplace? One of the first things that Eric and I recommend is identifying a pandemic coordinator or putting a team in place with defined roles and responsibilities for disaster preparedness, epidemic preparedness, and response planning. You want to make sure that that team is well staffed with a diverse interest within your organization, from HR, who's knowledgeable about the laws that are enforced by the EEOC as well as OSHA. You want to have someone who is from the communication department that can communicate effectively, your safety department, and then you want to be train your employees on the plan that you put in place, so that they are knowledgeable about what would happen, what their expectations are, what the company's expectations are, and what would happen in the event of a pandemic. You also may want to consider putting together an ADA-compliant pre-pandemic employee survey. And what that will help you assess is which employees are more likely to be unavailable for work in the event of a pandemic. Will they have to leave for childcare reasons if the schools are closed? Would they need to travel? Do they have other caregiving obligations? How can they be reached? And so that really also allows you to plan and put together this team and know where your employees may or may not be in the event of a pandemic. And then with respect to medical examinations, again, post-offer, conditional employment, or current employees, can be required of your new hires as you're bringing them in to determine their general health status, so long as everyone is required to go through the same tests and the information that's collected is considered confidential medical records kept separately from their regular personnel file. What about during a pandemic? Some of the things that you could do, we covered a lot of this in the slides previously, but you can ask your employees currently about recent places of travel, including personal travel. It's important for you to know if they have been in Africa, in West Africa, in one of the 3 countries, and have had close contact with a potential Ebola patient or family member. So if they have, you can ask related inquiries or require a medical exam, particularly if they're showing symptoms of Ebola or had contact with the disease. And in certain states like New Jersey and New York and Illinois, they're definitely providing some cover for employers to make those exams, make those inquiries, particularly if they've had contact in those particular countries with patients of Ebola. You can ask your employees to voluntarily monitor their temperature and other symptoms. That's permissible. For those employees who may develop symptoms, you can leave the workplace for the incubation period and decide whether you're going to pay those employees during that incubation period, whether you're going to require them to exhaust some sort of vacation or sick leave bank, or if you're in a state that has paid sick leave, what you need to do with respect to paying them during that time period. If they are not showing any symptoms and someone wants to stay home or you're asking them to stay home, again, that's your choice as to whether you want to pay them if they are remaining home for their own personal benefit versus the employer's benefit. Obviously, as all good employers and workplaces, you should require, infection control practices that Eric talked about, such as regular hand washing and sneezing etiquette, tissue usage. require your employees to wear PPE so long as accommodations are made if an individual needs an accommodation to wear particular PPE. And again, that's flexible depending on the type of workplace and the type of job that that individual has. Someone that's working in a hospital might have different protective gear versus someone who is working in a laundry or is a housekeeper at a hotel, for example. Again, consider your flexible leave policies to allow concerned employees to work from home if it's not going to disrupt your business and they are very concerned about coworkers. Allow someone to maybe work from home for a couple of weeks. And then importantly, keep all medical information confidential and separate from other personnel files, as I mentioned. After a pandemic, when everything's said and done and employees have been at home during the incubation period, can you require that employee to provide a doctor's note to return to work? Absolutely. Under the ADA, that inquiry is absolutely privileged. If there is a mass outbreak and a real pandemic, you want to be cognizant of the fact that logistically a doctor's office may be too busy or a hospital may be too busy dealing with all the other issues related to the pandemic. So that might be a time where you would require an email or some other type of alternative notes in order to allow that employee to return to work, but you certainly can require it. In addition to the ADA, there's other employment-related implications, such as Title VII. You want to be mindful that Title VII and many state statutes protect race and national origin discrimination. So to the extent that you're taking any employment-related actions, whether it's disability-related or not, you want to make sure that they're based on legitimate business reasons and not any type of fear or stereotypes about West Africa. If you're asking questions about travel, personal travel, you want to communicate those questions to all employees, not just those of West African descent. You want to also make sure that you're protecting your employees from who are West African descent from any type of harassment or teasing or jokes or slurs or any type of harassment that may occur in the workplace because of who they are. We saw a huge rise in that after 9/11, or people of Muslim descent hearing jokes and slurs in the workplace from their coworkers. And what's happening in the news right now from West Africa certainly could lead to that as well. So you want to be mindful in protecting your employees who may be of West African descent. As we mentioned too, this relying on the CDC's new monitoring protocol will take a huge burden off of you to the extent that you're asking individuals who are returning from those locations who they had contact with, both under the ADA and under the CDC policies, because you can really rely on that from the public health authorities to make those legitimate inquiries. Another law that comes into play is the Family and Medical Leave Act. As you know, that provides for protected leave for individuals with a serious health condition to either care for themselves or care for sick family members. So that could come into play. Certainly, employees with Ebola symptoms would qualify for FMLA, whereas someone who may be on quarantine who's never developed any Ebola symptoms probably would not be covered by the FMLA. But may be covered by some other sick leave policy or other leave of absence policy that you may have. If they are covered, those qualified absences and paid leave benefits can run concurrently with the FMLA 12 weeks. And then always you want to consider your state leave rights and laws that could provide more expansive leave options, including paid leave in Connecticut and Washington, D.C. California is going to have paid leave in 2015. So you want to make sure you're taking all of that into consideration as well. HIPAA restricts covered entities and their business associates from disclosing personal health information without consent. Although doctors are allowed to release information with diseases like Ebola to the CDC without consent. PHI can also be disclosed to an individual who may have been exposed to a disease or may otherwise be at risk of contracting the disease. But it's important to remind employees that the rest of a patient's medical record remains protected health information under HIPAA if you are in a healthcare facility. One of the American aid workers who contracted Ebola and was in treatment in Omaha, Nebraska, there were 2 hospital employees who were not directly involved in his care, in his patient care. They decided to read his chart, and they were ultimately terminated for improperly accessing the patient's records and accessing protected health information. So, again, make sure that any employee's health information is kept in a confidential file. It is protected by HIPAA, and it's not accessed by other employees. And then the labor union, as I mentioned, I think the labor union is an interesting story here. The hospital in Dallas where a couple nurses were infected, that was not a unionized hospital, but the National Nurses Union became the national spokesman for those nurses and for their safety. And so they have been speaking, across the country and is in the media all over the place with respect to making sure that nurses feel protected and have the right type of patient care and safety. And in fact, there is going to be a national day of action on November 12th that nurses coast to coast are planning a day of strikes against certain hospitals to raise these issues, to make sure that hospitals have appropriate training, they're providing the right PPE that Eric has been talking about, and certainly to the extent that you are organized and you have upcoming negotiations, you should expect labor unions to start adding these types of issues of training and communication plans and protective personal equipment, regardless of your industry, to make sure that employees are well protected. I think labor unions will really use this pandemic preparedness effort both as a rallying cry for organizing and at the bargaining table. One issue that was interesting that came out this week, the IRS just released some guidance that employees can donate their vacation, sick, and personal leave in exchange for employer cash payments made to qualified tax-exempt organizations that are providing relief for the victims of the Ebola outbreak. So employees can forego leave in exchange for employer cash payments made before January 1st, 2016. And under that special relief, the donated leave will not be included in the income or wages of the employees. And as an employer, you can deduct the amount of the cash payment off of your taxes. So that I thought was an interesting development that just was released yesterday from the other day from the IRS. So let me get to some questions at this point. I know it's at 2:20, and I know some questions have come in to the chat room, and we can take some additional questions. Now's the time to put some additional questions up there, and we'll remain on the line as long as there are questions.
So, Carrie, you see the one.
I see here, hold on, one question. If you were under state-directed quarantine, like in New Jersey, would you be covered under the Family Medical Leave Act? I mean, that's an interesting question. I mean, the nurse in Maine is under that state-dictated quarantine, but she's had 2 tests for Ebola, and both tests have come back negative. So I think she would probably not qualify for a family medical leave because she would not be suffering from a serious health condition. I think that's probably where another policy, employer policy, might come into play if she is required to be out of work and whether she's protected. It's a very interesting issue.
There's another question here about whether if an illness develops in the workplace after a possible exposure, is that an OSHA recordable? And that's a great question. If the symptoms of the illness develop in the workplace, that's not enough alone to make it a recordable injury. It has to be a work-related illness. And so I would say if it is an infection that can be traced to the workplace, certainly the nurse in Dallas, that would be, I would certainly consider that to be a work-related OSHA recordable illness. But if this was something that was contracted while on a voluntary humanitarian aid trip to West Africa, come back and the symptoms develop in the workplace, even though there is a strong presumption of work-relatedness if symptoms appear in the workplace, if it is clearly not a work-related infection, then it would not be a recordable injury or illness. And also, I just to reiterate, so everyone knows, we are going to make the slides from the presentation today available for everyone. And also, we have recorded the webinar, and as soon as we figure out how to do so, we will post it either on our website or circulate links to the recording. And the recording will include the visual of the slides and the audio. And so that everybody knows, you should see in the bottom left corner of your screen the chat box, and there's an opportunity there to enter questions, type in questions, and of course you could reach out to us anytime after today with any questions that pop into your head or that you'd like to review offline. We're always happy to talk. We'll give it a little bit more for additional questions, but I certainly want to thank everybody for joining us today. This has been certainly an interesting topic, one that there's been a lot of coverage publicly about it. It was fun for me to kind of dig in and learn about this stuff and to talk about it with you all today, and especially to have this as our first webinar here at the new firm, and we're so delighted you all could join us. Kara, any parting words?
No, just echoing that as well. I thank everybody for their participation, and we hope that you find our upcoming webinars to be very useful. Thanks, everybody.